Hello everybody, today you will be studying about histamines and antihistamines. So basically histose means tissue, it is a bioamine which is mainly present in the tissues, okay. So and the important cell where it is present is mast cell, okay. Mast cells is where histamines are mainly present. Apart from mast cells of skin, lungs, gastrointestinal mucosa is the major site where it is present. Apart from this, it is also present in the brain, okay. Non mast cell histamine is mainly present in the brain where it acts as a neurotransmitter. So coming to its synthesis, it is mainly synthesized from the amino acid that is histidine. From histidine, histamine is synthesized in the presence of enzyme histidine decarboxylase, okay. So when it is released from that cell is that it is mainly mediating the type 1 type of immunological reaction. So this type 1 immunological reaction, which is IgE mediated, it is mainly mediated by the mast cells and release of histamine, okay. And apart from this, the release is also mediated by some drugs like morphine, okay, succinylcholine, D-tuberculine and dextrin. So these will have allergic reaction if it is released. So this is also one of the important points to be remembered. So how does type 1 reaction, or how does this histamine release from the mast cell is what is depicted in this picture. So whenever there is an allergen which enters into the body, it is identified by the B cells, okay. And this B cells, they uh, trap this allergen and it becomes a antigen presenting cell, and this will present the various antigens to this is the mast cell, okay. There is a receptor and this antigen are presented and it will go and bind to the IgE receptor here, okay. And then whenever there is further exposure to the same antigen, so this antigen will again come and bind, and there will be subsequent contact with this allergen will lead to degranulation of this mast cell, resulting in release of histamine, leukotrienes, and uh, which will cause allergic reaction. So this is how it will happen. So moving on to various type of histamine receptors. So basically there are 4 histamine receptor. 1 and 2 are very important. 3 and 4 are mainly present in the brain, and this is in the mucosa, but they do not have any significant action and we don't have any drugs. So H1 receptor, it is mainly present in the smooth muscle and smooth muscles and vascular endothelium, and also in the brain, and they mediate smooth muscle, it will cause smooth muscle contraction, okay. And they also in the vascular endothelial also it is present, there it will increase the vascular permeability and cause vasodilation. And this you should very much remember. In the brain, the sensory nerve endings of the also contains H1 receptors, and it will cause itching, okay. So this is the normal function of H1 mediated histamine release action. H2 is mainly present in the stomach, okay, and cardiac muscles and brain. In the stomach, very important, H2 will cause increase in gastric secretion, and this is mediated through cyclic KMP. And in the blood vessels, it will cause vasodilation by increasing vascular permeability, okay. And same in the brain, it is involved in the sensory nerve ending, pain and itch. So H3 receptors, they are mainly present in the presynaptic junction, and they presynaptic levels, and it is an autoreceptor. This is very important. H3 is mainly present in the brain, and it will cause auto-regulation of the receptors, and it will, since it is an autoreceptor, so the release of its own, that is histamine, is decreased, and its secretion is also decreased, and this also causes vasodilation. So this is the function of H3 receptors. H4 is present in the hematopoietic cell and also in the gastric mucosa. The function of it is not that significant. We mainly read about H1 and H2. H2 significance is it is present in the presynaptic, and it is one of the examples for autoregulation. So moving on to the actions which is mediated by H1, which we have already mentioned. It is mainly present in the sensory nerve endings, peripheral nerves in the sensation. So sensation of afferent nerve endings is important, and bronchial smooth, because it is present in the smooth muscles. So bronchoconstriction and intestine contraction is all mediated by the H1 mediated action. Endocrine, it also increases the secretion, and this is also very important. In the brain, it is also present in the hippocampus and midbrain, and it is involved in wakefulness of a person. Okay, this is also mediated by H1, very important. And both H1 and H2 mediated action is because they are present, both are present in the blood vessels. So they in the arterioles and post capillary venules, so they will cause dilation and decrease in the blood pressure. Histamine will cause dilation and decrease in BP. That is H1 and H2 mediated. They also increase the capillary permeability. Okay, this is also one of the reasons for decrease in BP. Heart, it will increase the heart rate and force of contraction, H2 mediated. Both H1 and H2, mainly H2, increase in heart rate and force of contraction. Triple reaction, that is wheel flare, all these are also produced by this histamine reaction. And severe hypersensitivity reactions can also be demonstrated with histamine, and this action is mediated by both H1 and H2 receptors. So in the stomach, so effect is it will increase the gastric secretion. So clinical significance is in the peptic ulcer disease and heartburn. So if you give, it will increase. So you have to give something which will act as an antagonist at that receptor. So adverse effects, because it will cause itching, okay, and bronchoconstriction and all that will happen. So there is a chance of urticaria and also flushing, which is also because of vasodilation. Okay, hypotension can happen because it will decrease, it will cause vascular H1 and H2 mediated vasodilation. And tachycardia, H2 mediated action. Bronchospasm, because it will cause bronchoconstriction, smooth muscle constriction. Angioedema can happen. Wakefulness, lack of sleep, and increase acidity, because it will increase the gastric secretion through H2 mediated action. So these are the adverse effects with histamine. And as an agonist, it is not used anywhere, and only one agonist is there, that is H1 selective histamine analog, which is beta histidine, very important, beta histidine, and this is used in the treatment of vertigo in case of Meniere's disease, okay, where it will cause vasodilation of the inner ear, and it will improve the blood circulation and improve the Meniere's disease. And it is contraindicated in case of asthma and peptic ulcer, because it will cause bronchoconstriction and it will increase the gastric secretion. So because of these two reasons, it is contraindicated in these two conditions. So to classify antihistamines, in this chapter we are mainly dealing with H1 mediated action. H2 as it will increase the gastric acid secretion, so it is in the separate chapter usually. So H2 mediated H2 antagonists are ranitidine, famotidine, okay, they are all H2 blockers which are mainly useful for gastric ulceration, or in case of Zollinger's disease, peptic ulcer, all those conditions it is most commonly used, and also in pre-anesthetic medication. So as an antiemetic they are all used. So this classification of antihistamines mainly means those which act on H1 receptors. Okay, I repeat, it is mainly H1 receptors. So they are divided into first generation and second generation. Okay, so first generation antihistamines involved diphenhydramine, dimenhydrate, doxylamine, promethazine, hydroxyzine, pheniramine, cyproheptadine, meglizine, chlorpheniramine maleate. It is very important, very commonly used for any anaphylaxis because of any blood transfusion or even anaphylactic shock. The brand name Avil, which will contain chlorpheniramine maleate. Okay, and dexchlorpheniramine. So these are first generation drugs, and the second generation group of drugs are cetirizine, levocetirizine, very popularly used, and fixofenadine, loratadine, desloratadine, ibastine, astimizole, acrivastine. So these are second generation antihistamines. So this is a small picture which will help you to remember. So marked first generation antihistamines which is having marked potential. The major drawback of first generation antihistamines is sedation. Okay, so because of this drawback we are using it for few conditions. With potent sedative effect is chlorpheniramine, diphenhydramine, doxylamine, hydroxyzine, meclizine and promethazine. Okay, so promethazine is an drug which is used in case of pre-anesthetic medication. It is used as an antiemetic also. Doxylamine, it is all used for as an antiemetics. So in case of motion sickness, cyclizine, diphenhydramine, dimenhydrate, hydroxyzine and meclizine. So see, because of this sedative effect only, it is all used in motion sickness. And second generation, they have, I already mentioned, they do not have sedation side effect. Compared to that, it is very less. Okay, acrivastine and cetirizine, weak potential for producing sedation. And desloratadine, fixofenadine and loratadine, they are non-sedative H1 antihistamine. Coming to their therapeutic uses, because of these conditions, since it has its action on vascular smooth muscles, so they have been widely used for very commonly caused allergic conditions like rhinitis, urticaria, conjunctivitis. Okay, any itchy conditions like atopic dermatitis, and also in case of bronchial asthma and anaphylaxis. Anaphylaxis I mentioned already. First generation antihistamine, it is very commonly used. Very important use of H1 antihistamines is in allergic conditions. And also as an apart from that, as an antiemetic, motion sickness we saw, and morning sickness, doxylamine is the drug which is used in case of morning sickness in pregnancies. It is also given for insomnia because of its side effects, that is sedation is one of the side effects of H1 antihistamine. So because of that condition, because of that reason, insomnia, it will cause it induce sleep. So there it can be used as a pre-anesthetic medication also. It is used as I already mentioned. So in case of cough due to dry cough due to some allergy, and also in case of vertigo, meclizine what we saw, so those things are used. And because vertigo, because they have anticholinergic property, that is the reason why we give. And also in acute muscle dystonia. So these are the major uses of H1 antihistamines. So moving on to the specific agents, antiemetics, hydroxyzine and promethazine. Promethazine I already mentioned. So hydroxyzine, these are also used in case of pre-anesthetic medication, motion sickness and vestibular distribution. So because they have anticholinergic property, diphenhydramine and promethazine, they are, and also cyclizine and meclizine, so they are there. These two will produce sedation, that is diphenhydramine and promethazine. So that is why they are not commonly used. Cyclizine and meclizine, they are less sedative when compared to that, and commonly used for motion sickness and vestibular, that is Meniere's disease. And morning sickness, I already told, it is doxylamine, which is commonly used in case of first trimester pregnancy vomiting. And allergic condition, as I already mentioned, itching, sneezing, rhinorrhea and allergic conjunctivitis, they are all, it is used. And azilastine and olapantadine is a topical preparation which is used for, which can be used for allergic condition. Adverse effects, that is because of their anticholinergic property, that is these things only we are using as an antiemetic. So there can be blurring of vision, dry mouth, all these are anticholinergic side effects. Tachycardia, urinary retention, dizziness and drowsiness. Okay, paradoxical excitement in infants and children because it causes overdose with estimazole and terfenamide can lead to arrhythmia. That is why it is actually banned, terfenamide. And it is contraindicated in case of acute angle closure glaucoma, okay, hypersensitivity reaction, and also urinary obstruction because it causes urinary retention. No? So because of these conditions, they are contraindicated in these conditions. Any hypersensitivity to this tablet, it is contraindicated. The reason might be because of some excipient which is used in the tablet. So coming to the drug interaction, so terfenamide and estimazole is having some interaction with ketoconazole and macrolide antibiotics because they also cause arrhythmia, and that is why they are withdrawn from the market. So grapefruit juice, which will inhibit CYP3A4, increases the levels of antihistamines because antihistamines are metabolized by this enzyme. They mainly produce mechanism of action is they mainly H1, they will competitively antagonize the H1 receptors. So coming to the H2 blockers, second generation antihistamines, second generation H1 blockers. So the importance here is they lack sedation and they have less anticholinergic property. This is why there is second generation. These 2 points are very important. Second generation do not have any anticholinergic property and they do not cause sedation. So examples we have already seen: fexofenadine, estimazole, loratadine, cetirizine, levocetirizine, azilastine and terfenamide. So these are second generation antihistamines and they are mainly used for allergic rhinitis, dermatitis, allergic conjunctivitis, urticaria and common cold, as we saw with first generation. The difference is that they have less side effects. So advantages of second generation over first generation, very commonly asked and very important points. No anticholinergic side effects. They do not cross blood-brain barrier. That is why there is no drowsiness or sedation. Okay. If it produces also, it is very minimal when compared to first generation, and there is also no psychomotor impairment because of sedation and drowsiness. There is no psychomotor impairment. So here are a few MCQs, 2 MCQs I have mentioned. So please go through. Thank you.